It's now time for our panel session featuring the important topic of patient access. And today's session will be moderated by Teresa Nicoletti, who I'd like to invite up to the stage now. And our wonderful speakers today, our panellists, include a special group of people I've honoured to be able to introduce you to. Via Zoom, they include Michelle and Jai Whitelaw, who I first met many years ago now in 2014. Michelle is amazing. Her story first aired on Sunday night, Channel 7, regarding the plight of accessing medicinal cannabis, and she was a really prominent voice in the medicinal cannabis debate. She's one of the fiercest advocates you'll ever meet, and her gorgeous son, Jai, continues to amaze and inspire. Also, Teresa, you can come up if you like and settle down. And oh, no, it's okay, you can just chill, and then it's all so informal here, don't worry, it's all good. There you go. So you can, yep, there we are. And then, because, Michelle, can you hear me? No. Yes? Don't know if she can or not. Maybe not. Anyway, she will. Okay, also joining us today live is veteran Derek Pyrah. Derek, are you in the audience? Yes, wonderful. It's good to see you. We met outside before. Yes, if you can please come to the stage, that would be wonderful. Derek's done a lot to advance the cause of how PTSD is impacting veterans and their families. He also recently appeared on SBS Insight, and that program was alluded to earlier today. We welcome him today, so please welcome both Teresa and Derek. And welcome. And we also have the lovely Brendon Clarke, who has a very powerful story to tell. Brendon, are you in the room? Hello, it's nice to meet you. Now, Brendon's background includes diagnoses of ADHD and autism spectrum disorder and a regime of drug cocktails which included powerful antidepressants. When he was introduced to cannabis, his world changed. It was life-altering. And when we catch up with Brendon, I think we're going to find out where things are up to now. So, welcome everyone. Hopefully we'll get Michelle online soon, but there was also a plan, I think, to play the video of Michelle and Jai's story. So we might do that before we hand it over to Teresa to moderate the panel. Oh, okay. So Michelle's not answering yet, but we'll cut to her story and we'll just see how we go there. All right.
Can I just confirm that we have 45 minutes? I know we're running behind time. Thanks. Thank you, Robin. Should I just start with, or will we, do we have a video? I'm just conscious of time and not eating more into the time.
Sounds like a cure. To me, it sounds like liquid gold.
Hospital records show that Jai's epilepsy caused up to 500 seizures a day. The human toll on the family, and especially Michelle, was exacting. This is a post she addressed to the online epilepsy community a year ago.
That's epilepsy. That's my life. Try living not knowing if your kid's going to wake up tomorrow, because that's what it's about. That's the life we live. There's no sleep, there's no rest, there's no privacy, there's no life, there's no nothing. I don't know how I'm meant to be happy or how I'm meant to look forward to life or tomorrow when it's just suffering and pain. I'm just not cut out for this anymore. I'm tired. So tired.
At breaking point, Michelle made a decision that not only changed her life, but the life of her son, Jai. She contacted one of the main black market suppliers, Tony Bauer, who started administering cannabis oil drops to Jai day and night. So, and what's life like now for you?
Yeah, I'm tired because he's so
active now. He's
So you're
alert.
tired for a different reason.
I was tired before because I never slept, and now he's actually keeping me up and living off less amount of hours sleep because he wants to discuss everything. He wants to communicate. He wants to learn. He wants to, just go. So we've had so many firsts, like he can now ride a bike. He's never been able to ride a bike. He's kicking a ball with no problems, no falling over. He's now getting his first report card ever. It's just everything. It's like everything's changed, and it's changed that much and so quickly in such a short time.
And do we have Michelle on the line? And
Hello.
Oh, hello, Michelle. And
Hi.
can we get rid of that cursor there? Do we have Jai as well, or just you, Michelle?
Jai's doing art therapy in the kitchen, and I said to him when he's finished in about 15 minutes to come in.
So I've had the pleasure of knowing both Michelle and Jai for many years, and it's just been an extraordinary journey for Michelle. With Jai's progress in particular, you saw the video, the start of that journey, and also the enormous response that he had to medicinal cannabis. I'd just like to ask Michelle to talk more about Jai's progress since then, and any insights you would like to give to the audience about your experience with medicinal cannabis.
Yeah, well, I suppose there's so much to tell, and to keep it sort of very short and brief, up to that video, Jai was doing very well on an unregulated product, which we source on the black market. And I can't remember, I only just saw the end snippet of that video, but I think it was around June 2017, we actually received an off batch, and all the seizures returned. They were brutal after a couple of years of being seizure free. And we ended up back at the beginning where we were constantly calling paramedics to come out. He was taken into ED. I think in a very short period of time, about 40 ambulances in about a 6-7 month period were called to the house. He had experienced quite a few resuscitations. And even though we had the EEG evidence, the medical system could not at that time prescribe a similar product. So Jai had his medical team put him on temporary medications like high-dose benzoanapines until he got approval for Epidiolex. That was denied twice before he was approved, and after a short time of getting access to that, he actually ended up with no seizure control, back in ED, and actually discharged with a letter stating he had actually had Epidiolex poisoning. Long story short, from there, we waited another 8 months, put back on high-dose benzoanapines, and he was finally given federal and state approval for a sister-like medication, cannabidiol, and we were given a 12-week period in which to gain some form of seizure control or seizure reduction. And he was back in, he had 3 back-to-back generalised tonic-clonics, which also included him being resuscitated again. And we had then 8 weeks up our sleeve to make it work. Otherwise, he was going to be connected to PAL care. So I did what I knew best, which was to split all the doses up. And 24 hours later, we haven't looked back. He hasn't had a generalised tonic-clonic since. And he's been now on monotherapy. I wrote the figures down. It's been 1,276 days since the last tonic-clonic, and it's been 1,099 days he's been on cannabis monotherapy. He's got now quality of life. He's able to attend school. He's actually doing work experience in year 12, about to turn 18. But the whole process, and I actually feel guilty that we fought so hard and got access and a legal product. Why a lot of families don't get that chance, or did not get access and have buried their children. And we're now transitioning over to adult care. They will honour the prescription. That's all he's on and been on for quite a few years. The EEGs are all clear and tidy, and he's just hitting goals all the time. I'm so proud of him.
It's a fabulous story, but look at the journey that it's taken, Michelle.
Oh, absolutely. And all the, just the process, waiting 8 or 6 months, at a time with nothing but high dose benzodiazepines. Like, this is medication number 22. And, the side effects and the amount of resuscitations, and, there is a lot of long-term damage that is irreversible, and a lot of deficits. But, he's out of a wheelchair. He doesn't wear a helmet. He's not nasal gastric fed. He looks normal, but we will always have a lot of therapists on board, a lot of specialists on board, and that's forever, and it's long term. But the seizures are at bay, and for that I'm very grateful.
Thank you, Michelle, for sharing that story. There are a lot of learnings from this. Thank you so much.
You're welcome.
And we need to use these case studies to guide our experience with the use of medicinal cannabis. It clearly shows that there's a lot to learn, particularly about the right types of products to prescribe in cases like this of severe epilepsy. And also, Michelle's case is a perfect example that medicinal cannabis products are very different, and it's finding the right treatment for the right condition. Thanks again, Michelle.
No worries.
I might move now to our next patient. That's Derek. Now, Derek is a veteran, I understand, and his story is all around the ability to use medicinal cannabis in the workplace. So it touches a lot on the discussion that Stipe, sorry if I didn't pronounce this properly, had during So Derek would like to focus on the discussion around the use of medicinal cannabis for the treatment of PTSD.
Yep. Thank you, Therese. Hi, everyone. My name's Derek, and like Therese said, I'd like to just briefly talk about medicinal cannabis use for post-traumatic stress disorder. Be a brief background for myself. I joined the Air Force in 1990 when I was 15 as an apprentice, and trained in as an aircraft technician mechanic. Did that for about 9 years, and then switched over to a communications role in the Air Force. And then in 2003, I went to Iraq in February to do the sort of stuff you got to do over there. Stayed there for most of the year, and came back home at the end of the year, and a few months later I was starting to get treatment at work, talking to the psychologist for I guess PTSD, what became diagnosed as PTSD. When I got home from overseas, everything was really different. I was different. How I walked, talked, acted. My wife at the time and my family all saw that, and yeah, I couldn't do my job properly. I was forgetting everything, argumentative, cranky, just all sorts of bits and pieces. So I thought I'd had enough in the military. I'd been in almost 15 years at that stage. So I got out and couldn't really find a job, even though I was a qualified aircraft technician and had a lot of IT and communications experiences from the military. So highly qualified, but I couldn't really do any, a job interview, I'd sort of forget everything, or I'd almost soil myself, or I'd just go to, things didn't work too well. So 2006 was the first time I was given a prescription of medication for PTSD. So it started off as an antidepressant. I think it was Effexor or something like that, really low dose. Within a year, my medications had been probably 3 or 4 medications, and then in that first year I was also started my hospital treatment for PTSD. I found over the years the medications increased, my hospitalization increased, my health declined, cognitive, I guess, functioning with all the medications in me, I couldn't really function at all. You sort of feel like you've got cotton wool in your head, all these medications for PTSD. I can see some people nodding their heads out there that they sort of, they've seen this before. So then nothing was working. My marriage ended and I was a bit desperate, and I saw a documentary on SBS about these 2 American Iraq veterans. One was using Veterans Affairs VA approved and supplied medication. The other one was using cannabis, and the difference between the 2 of them, one had quality of life and was happy, had a family. The other guy was living by himself alone, pretty bad. But that's sort of how it gets for some people, and that's where it got for me. So I tried a bit of cannabis recreationally when I was in my 20s and stuff like that, and people do that, fair enough. But then when I tried it I remember the first time I tried it, I guess for PTSD, that was in 2016. I'd had like anxiety so crippling at that stage that it was hurting me, it was so painful, and depression as well and everything else. But as soon as I had that spliff, it was just starting to like, oh, hang on, this is pretty cool. And the anxiety feeling just went, like that one in the pit of your stomach, that's just shocking, And I was like, this is pretty good. This shit works, Sorry, this stuff works. Sorry. And so then I found, so I was using it illegally. While I was using cannabis illegally, I was reducing my medications for PTSD, my DVA pharmacy medications. My medication levels were pretty high. You guys have probably heard about Seroquel and other drugs like that. Yeah. So I think the dosage of Seroquel I got up to was about 1,800 milligrams a day, which is about 4 times over the maximum recommended and stuff. But the thing is with PTSD medications and other mental health medications is when it doesn't work, they increase the dose, or they go to another one that may or may not work, or something else. So it's all this trial and error of stuff that, just masks things. It doesn't actually allow the person to try and heal from their experiences, because you can't process or heal anything when your brain is just so clogged full of these medications. So from 2016, as I was saying, I started using cannabis, reducing my medications, the pharmacy medications, and just recently, last month, I came off the last of my pharmacy medications. So I'm finally, like after, 2006 through to 2022, that many years on those medications, and it's, thank you. But, so I've seen a difference in myself, and I've talked with other veterans and obviously met other veterans through the years with the same thing with, PTSD and stuff like that. You meet them in hospitals and everything like that. The ones that are starting to use medicinal cannabis are improving. The ones that are stuck on the other medications are not. They're going to be that way, yeah, forever. So what I found is that medicinal cannabis worked for me in my instance. Started looking at the studies and seeing that there were studies that showed, you know, what it's doing and how and its benefits. And now I'm at a stage where I'm trying to get the Department of Veterans Affairs to overturn a policy. So currently veterans with PTSD can't access medicinal cannabis. It's financially out of their reach because they're not able to work, a lot of these men and women, because of their injury in their head and everything else. So they're financially reliant on Veterans Affairs. Veterans Affairs, you know, will not currently give any medicinal cannabis for mental health issues because apparently there's insufficient scientific evidence. And that's the statement that they're sticking to no matter what. So I've, with the help of Lucy and a few other people, I've got a little campaign going called No More Zombie Veterans. And just to try and push it in the face of Veterans Affairs that this policy needs changing. So studies around the world show a lot of benefits for using medicinal cannabis for PTSD. There's currently a Royal Commission into Defence and Veteran Suicide running, which is pretty important. The findings of that are obviously going to show that there's a lot of suicide going on. One of the findings we found with medicinal cannabis, this is from the Canadians, so yeah, the Canadian government reports, about an 80% reduction in suicidal ideology for veterans when they're on medicinal cannabis as opposed to the traditional medications. The Israelis are finding similar results, and here in Australia, some clinical data is showing that as well. So the evidence is overwhelming. If you were to do the pub test, it'd pass hands down 50 times over. And yeah, hopefully sooner or later can change a policy with Veterans Affairs to help veterans out.
Thanks, Derek. And it is a policy position. I've had a look at the policy position. It's not backed up by any evidence to hold that position, because there is a lot of evidence out there on the treatment of mental health disorders, including PTSD, for which there is strong evidence. And those of you that might actually interact with veterans, I would encourage you to make a submission to the inquiry. It's an inquiry into veteran suicide, and this is one of the key factors that increases the risk of suicide when the veterans don't have access to proper treatment. So thank you. Please thank Derek for sharing his story. And I now move on to Brendon. I apologise, I confused the two of them because initially Brendon was going to go first, so my apologies for that. Brendon is going to talk to you about workplace and his experience with medicinal cannabis in his work environment.
Thank you. Sorry, that was a bit loud. I'm not used to being up here for microphone, so apologies. Oh, there's me and my wife. I basically was every parent's nightmare growing up, and to some extent still am. I'd used probably 8 of my 9 lives if I was a feline by the time I was 17. I had 2 subdural hematomas, had been, one of them was quite extensive and quite prolonged. Hit by a car at 70 kilometres an hour, I was trapped underneath the car, came to consciousness underneath the car, regained consciousness, I should say, under the car. And generally got up to a lot of mischief that had physical repercussions that you begin to feel later in life. And along with brain injuries or traumatic brain injury came migraines, which is something that I'd been trying to treat since a very young age, going from everything through beta blockers, Immigrant, traditional depression medication, and none of it at low dose, like NDEP, for instance, and none of it was having any effect. So I ultimately ended up on at quite a young age, in my 20s, on a fairly stringent regime of opiates, which eventually take their toll on your body, and is certainly something that I was well aware of. Anyway, I ended up adding to my parents' concern, started to work in an underground mine. I was the gentleman that spoke out before about, in reference to the gentleman referencing mining. So I was an underground maintenance fitter, so looking after all the heavy equipment underground. So we did have a train underneath, 900 metres down. We also had a rock crusher, for instance, that was 9 stories tall. Everything is extremely heavy duty and hard work. So that I damaged my back and my knee during that extent while I was on the tools. Worked my way into management with both the mining company and then for a private company, and ultimately ended up in my mid-30s having complete nervous breakdown. My family checked me into the psychiatric department of our local hospital. I went through the usual psychiatric, cognitive and psychometric testing, came out the other end with quite an enlightening diagnosis at the end of the day, because it helped both my wife and I understand who I was to some extent, why I was the way I was, I should say. And that was ASD level 1, or traditionally Asperger's, adult ADHD, symptoms of adult ADHD brought on by traumatic brain injury, chronic depression and anxiety. And after that, so in my mid-30s, I was prescribed, again, the same, I was on 200 milligrams of SNRIs, 100 milligrams of Valium, along with beta blockers for migraines, and still opiates to that extent. At that point in time, it had escalated from codeine to oxycodone. So it was obviously quite concerning. And once I found myself in that position where I was essentially mentally broken and learnt so much about myself and had to rebuild myself, as it were, as a person, is when I was lucky enough to meet Deb, one of the organisers here, who introduced me to cannabis. And cannabis is something, particularly in the mining industry, looking after. At times we had 300 personnel fly in on site, and if I had 10 of them fail a fitness for work test or a urine sample, our company would be kicked off site. So cannabis was always something that I steered well clear of. And when I saw it in the news, it almost came across as a midday talk show host trying to sell the next great protein shake that solves everything from, bedwetting to regrowing a limb. And so I was dubious, to say the least, until I did some research of my own. I have a tendency to dig rabbit holes into subjects I find fascinating. And after doing a lot of research and with Deb's advice, I sought medicinal cannabis, and it changed my life. I'm a better husband, as a person with ADHD, ASD, I should say. If anyone here is familiar, social situations are very, very awkward, and it alleviates that. I can now be a functional member of a family gathering or a party or any gathering with more than 4 people, for that matter, without hiding in the corner or hiding behind my iPhone and my wife's friends pointing the finger saying, "Who's that weirdo in the corner?" and her having to admit that that's her husband. So that's certainly something that's been remarkable for both of us. And yeah, she's been wonderful on this journey as well. You can see her there in the photo. But and just to speak on work, this is something that I'm quite passionate about. With the mining industry, I can speak of at some extent because I had experience in both the management team of both a major mining corporation and a contractor that supplied services to that mining company. So I got to see both sides of the coin. And unfortunately, the problem that we find ourselves in is these big companies, to mitigate their exposure to risk, they hire contract companies. So you're not actually failing a fitness for work for a 3-letter mining company. You're failing a fitness for work for Joe's Mining Incorporated, and in that way they avoid any lost time injuries caused by medicinal cannabis or anything else. So it's a zero tolerance policy. Now, when you're working for BHP, sorry, scratch that from the record, Your Honour.
Chatham House rules, everybody.
Yeah.
We don't talk about anything outside this room.
Something that rhymes with that. I can't think of one on the spot, so anyone help, please do. So when you're working for a mining company themselves, and you're responsible of looking after the contract companies that are doing major maintenance works for you, you have them on a very short leash, because the market is so competitive. Everyone wants to start a mining company in this country. We used to live off the back of a sheep. We now live off mining as a country, and everyone wants a slice of that pie, and rightfully so. But the issue becomes that it's so competitive that a major corporation can say, we have an absolute zero tolerance policy when it comes to alcohol and illicit or prescribed drug use, and you have to comply, otherwise they'll find somebody else. And I've sat on both sides of that coin. And the other issue is that, to add to the previous speaker, the lawyer, I was working on site with heavy machinery operating 50-ton cranes and driving an underground train. I did crash an underground train, but I wasn't high at the time, just for the record. Yeah, it caused a lot of damage. I got known as Peter Pan after that. For those that don't know, the little bit that sticks up from the train to touch the catenary, the live wire, that's called a pan. I ended up ripping that off of the entire train, so I was known as Peter Pan from then on. But anyway, so I was quite within my right to go onto that site, having oxycodone, Prestique, benzodiazepine, Valium, whatever, or Moralax, whatever it happened to be at the time, and pass a fitness for work test and go on site. So what I think needs to happen, or something that from memory, the metabolite cutoff was 50 nanograms per milliliter for THC. Now, I can testify based on flying to Adelaide and then driving 8 hours out to site with people on my crew that appeared perfectly fine. I mean, I was in a position where if I thought they were impaired in any way, I wouldn't have continued driving to site with them, because they'd put our company in great jeopardy. And they failed a drug test. They were in no way impaired. They'd consumed cannabis in their own time. They had a 14-day downtime. During that 14 days, they're within their, maybe not within their rights, they're free to do what they want in their spare time. And we had people failing drug tests for that reason, because they'd used it recreationally or perhaps even medicinally, I'm not sure, in that space of time. So the metabolite cutoff limit either needs to be adjusted for people that are, for prescribed patients, so that there's a clear distinction between recreational use and prescription use, because as a medicinal cannabis patient now, I can say I am most definitely have greater control of my faculties than I did when I was on opiates. So I think, and the same for roadside testing. We used urine testing in the mines. I know roadside testing is a saliva swab, and I'm not so sure what the metabolite cutoff is for that. I believe it's shorter, but smaller, I should say. But again, it'd be nice to see some sort of studies to, as the previous gentleman said, impairment, I think was the word he said. At what point are you impaired? Like we've, as a society, come to understand, when you're impaired under the influence of alcohol, you blow over, or under. At the moment, that's not the same for cannabis, and specifically for medicinal cannabis patients, there should be a metabolite limit within your legal bounds, so that you don't lose your career, which is essentially, if anyone has any jobs available.
So the issue here is that THC, medicinal cannabis, is treated differently from any other drug that has the potential to cause impairment, like morphine, oxycodone, the benzodiazepines, some of the antipsychotics, and it cuts across workplaces and it cuts across the driving laws as well. With the driving laws, it's the mere detection of THC at the lowest possible limit of detection that the equipment that's used can detect it, regardless of whether it causes impairment. So it is a discriminatory issue. The drug driving laws are being tackled as much as we can, but the employment issues also need to be tackled. Thank you, Brendon, for sharing your story. It's an important conversation that we need to have. Now, there was going to be a fourth patient who was going to appear in person, but that patient is too unwell, and I spent some time with that patient's spouse. I have known this family for a couple of years, and we wrote together a story that they have asked me to share with you tonight, and I think it's such a strong story that I want to read it to you now. And if we've got a few minutes left after that, then I'd like to open it up to the floor for questions, and if perhaps we can have a roving mic so everybody can hear the questions. But this will take about 5 or 6 minutes to read, so if you'll just bear with me. In 2020, the patient was diagnosed with stage 4 cancer. To say that the family was shocked is an understatement. The patient was a fit and healthy 53-year-old who never went to the doctor and barely even ever got a cold. The patient was diagnosed with one of the most aggressive cancers with the worst outcomes and with extensive metastases. After getting over the shock, the family decided to look to the people who were defying their prognosis for the same disease. Those who were having better than anticipated outcomes, both with quality of life through treatment, and those who are outliving doctors' predictions and expectations. These people were all using cannabis. Despite never having used drugs, out of desperation, this patient was willing to give it a go. Using cannabis challenged the patient and their family on many levels, not just because of fear about the potential physical and mental impact, and even so, out of desperation, the patient took cannabis. It took a while to adjust using the cannabis, but once they did, they fully embraced it. The impact of the chemotherapy on the patient was brutal. The evidence the family gathered indicated that high doses of cannabis would be required to restore quality of life and have any chance of mitigating the effects of the cancer. Because of this, they went to the green/grey market and sourced a high-quality product based on their extensive inquiries. The difference medicinal cannabis made to the patient's ability to sleep was astounding, going from being agitated and up a lot of the night to sleeping comfortably for 8+ hours every night. The patient also had very little nausea and vomiting on cannabis and maintained a good weight. Notably, the worst side effect from the chemotherapy was peripheral neuropathy, and that subsided dramatically as well. The patient's tumour markers, biomarkers, dropped dramatically to extraordinarily low levels. After using medicinal cannabis for a few months, the patient made an appointment at a new cannabis clinic established close to home. The family wanted to use illicit medicinal cannabis because they were uncomfortable with the green-grey market. However, although well-intentioned, it became evident very quickly that the GP they went to really didn't know what to prescribe for the patient, advising that there were more than 300 different products that could be prescribed and that they were uncertain which one would be best. The patient saw 3 more prescribers, but none of them satisfied the patient's needs. They seemed to have less knowledge than individuals that the patient had consulted around the world who advocate using cannabis not only for symptom control of cancer, but also as an active treatment. Most recently, the patient's pain escalated to the point where cannabis was not able to keep it under control, so the disease started to progress. The patient was admitted to hospital for pain and symptom control, uncontrollable vomiting, and 5 days of constipation after the introduction of opioids. In hospital, they were unable to get the patient's bowels moving or the vomiting to stop. They actually asked the patient to cease cannabis so they could try to get to the bottom of everything, but that made the patient worse. 2 weeks later, the hospital told the patient's spouse that the patient was end of life. A bad reaction to methadone coupled with infection and pulmonary emboli had brought the patient to a point that they believed that death was imminent, but the patient didn't die. The patient decided to reintroduce cannabis on a start low, go slow basis, but it was so low and so slow that it did not impact the pain. The advice from the palliative doctor instead was to double the dose of opioids and take them more frequently. The patient overdosed and was taken back to hospital. The patient then consulted another prescribing GP, supposedly with experience, and under that guidance, THC drops were introduced. Some sleep was restored, but the dose was 1/15 of the dose that had restored the patient's quality of life using green market product. The dose was insufficient to remove the need for opioids, and therefore the issues with bowel movements, mood enhancement and pain management remained. The GP said that the limit of THC that was able to be prescribed was 56 milligrams, even though amounts that had been used in practice have been as high as 1,000 milligrams. The distinct impression was that prescribing doctors had their hands tied by the bureaucracy on how much they can prescribe. The patient made the decision to take more cannabis and return to the green market. It reduced dependence on opioids from 5 to 6 breakthrough doses per day to just 1. The family got their loved one back, who was back to their old self. The quality of life was so much better when the opioids were replaced with cannabis. The oncologist is aware that the patient is taking cannabis. Initially, they stayed neutral in their position, and at one point, the cannabis community advised that it is important to take breaks from continued use of cannabis in order to reset the receptors and reset tolerances. However, during this break, the patient developed lethargy, loss of appetite, and a general state of malaise. And then the oncologist advised the patient to get back on cannabis. The family GPs are also aware that the patient uses cannabis. They were initially reserved in their view, and now that the patient has outlived all initial prognoses, there is tacit approval from all of the patient's medical practitioners, but none of them have tried to assist that patient with access or have shown any interest in finding out more so that they can help other patients. In the absence of supportive and authoritative advice from medical professionals, the patient has had to rely on other patients and families and others who are experienced in helping other patients. It has been most useful assistance that this patient has received. In fact, it has been much more useful than any assistance that the patient has got from the medical community. This patient is testament to the benefits of cannabis. The initial prognosis was 3 months, and the patient has now survived for 2 years post-diagnosis. And that's just sent chills down my spine. The current situation doesn't afford patients like this patients with what they need to get the most benefit out of cannabis. Now, that's the story. The question is around patients who have a terminal illness. What are we doing to ensure that they have the best possible quality of life for as many months or days or years that they have? And this is a really sad story. I'm very close to the family. They're a lovely family. They have 4 children. and this is something that needs to be addressed. I'd like to throw it out to the floor. Anyone have any questions that we can discuss? You can ask any of the patients, or you can ask generally, and one of us may answer. Come on, come on. Dr. Kirkham.
Thanks. Hi, I'm Dr. Stuart Kirkham. I'm an orthopaedic surgeon from Sydney. I really enjoyed that whole session. Thanks for such honesty and sharing. It was really heartwarming and really touched me. Thank you. My question is for Derek. Mate, that was such an amazing presentation, and I'd like to ask everyone a question, but Derek, I just wanted to can you tell us again how we can approach the VA, the Veterans Affairs in Australia, and lend some support, because I think it's a great cause.
Thank you for wanting to help and support. I guess the normal way to help with government matters is to write letters to politicians and all that sort of boring stuff. You know, talking to people. I have a little campaign going with the No More Zombie Veterans. It's on change.org. I think we're around 17,000 signatures now. Just trying to get as many signatures as possible. I don't really have a number, but I guess the more support we have there, the more we can show the government that, you know, people in Australia are behind this. People in Australia do want veterans to have access to medicinal cannabis to treat PTSD and to get better. Yeah, thank you.
Thank you. Thank you all for speaking so candidly about your stories. My name's Kate. I'm a nurse practitioner in palliative care and been prescribing medicinal cannabis since 2017. I just want to first of all mention that when it comes to veterans, I'm not, they don't accept my prescriptions for medicinal cannabis, but they do accept my palliative care medical officer, his prescriptions for it, and so they will fund it through with palliative care, so maybe that's a road in there. They've just refused my oxygen, which is very annoying, which I've just found out about as well. So the veterans can be really tricky. The other thing that I would just like to mention, one of my experiences is when you're talking about someone who's in end-of-life care who has a life-limiting illness, that we are finding a lot of help with medicinal cannabis in helping people complete treatments. Not necessarily that it would be that the medicinal cannabis is what is extending their lives, but they are able to front up for the treatment more often. They're able to complete them. They're able to continue their lives while they're having treatment. And that, I think, is a huge take-home message that we can use it in palliative and supportive care in that way. So, sorry, more a statement than a question.
Hi guys, you are all amazing. Your stories are just amazing. My name's Simone. I'm a nurse practitioner working in medical cannabis. One of the things I see, and this is kind of a statement and a question, is by the time you guys have been through everything, by the time they get to someone who prescribes it, the patients are usually quite angry. They're quite angry with the medical system. They're really angry with doctors, it's awful. They're really distanced from healthcare systems. They don't trust them anymore. They don't believe in the systems. So I'm gathering that you guys have all felt that at some stage too. And as a nurse practitioner, I want them back integrated in health systems. I want them connected to their GP. In my mind, and as a clinician, I'm 100% a clinician, I see that as a huge, huge problem, that in our apathy and in our inability to make medical cannabis more accessible, we're actually alienating a lot of patients. And I think that's a real problem in this country, where people just exit our systems and we can't find them.
We're going to have to wrap it up, everybody. Thanks so much to all of our patients today, to Michelle and Jai Whitelaw. You can see Jai on the screen. Hi, Jai. Welcome.
Hello.
And thank you to Derek and to Brendan for their poignant presentations, and thank you to the family who couldn't be here tonight, who shared with me their story as well. And thank you all again for participating.
And Teresa, thank you so much for chairing today's session. I think it was fantastic. Wonderful. Thank you.